welcome to my YouTube channel. This is Dr. K, this is the Gynae Talks, and this time we're talking about breast cancer. So this video, I promised I was going to make a video for you to know how to examine yourself whenever you're going to the shower, how to examine yourself, when to examine yourself. So make sure that you've shared, you've liked, you've subscribed to this channel, and you've told all your friends to watch it, because this is important. Preventive measures are the best thing. So this is a very simple examination that I'm going to teach you. I'm going to demonstrate it on myself, and you're going to do it at home. It can be done by both male and female, and all you need is a mirror right in front of you. If you're a female and you're in your reproductive age group and you usually have your period every month, do this examination when it's mid-cycle. Don't do it during your menstruation. This is because when you do it during your menstruation, you might find some changes in your breast, but that could be because of the hormones that are actively working at that time. So it's important for you to do it when it's your mid-cycle every month. So this is very simple, and you just need to stand right in front of your mirror. Of course, you have to undress and make sure that you can be able to see yourself very clearly. Stand straight in front of the mirror, and then what you're going to do is just look at yourself. Look at the breasts, look at both of them. Do they look the same? Is there any change on the skin? And remember, you need good lighting to be able to notice any changes on your skin. So just have a look at it without touching. Look at yourself, see whether there's any skin changes, check whether there is any darkness, or it looks like an orange peel. You know how an orange peel looks? That's one of the classic signs of a breast that has cancer, actually the one that has progressed a little bit more. Then you're going to look at the level of the nipples. Are they at the same level or nearly normal to what you're used to? Have they changed? Is there any discharge coming from the nipple? You can be able to see that just by looking. Then the second step you're going to do, you're going to lift your hand up. You're going to lift your hands up, and then as you're lifting, examine how your breasts look. Is one moving more than the other? Is there any pulling? You can see when you're straining something, you can see that it looks abnormal. Is there any change of shape when you lift your hands up? So that's another way of examining yourself. So the third step you're going to do, you're going to lie down. You can lie down on your back, on your bed, and then what you're going to do, you can place one hand behind your neck, and then with the other hand, you're going to examine your opposite breast. So what the main thing you need to remember is this hand, you place it flat and firm on the breast. And the breast, you have to examine from up here. You see, this is a clavicle. This is the bone up here, all the way down to where the abdomen begins. And then from this side, you're going to start from the sternum. This is this bone, all the way to your armpit. So you're going to examine all that area. So that's the area you need to examine. And as you examine, you're going to take in small circular motions, and with this hand is behind the neck, small circular motions, all those areas. And don't forget the nipple area. Then you're going to do the same thing on the other breast. So you're going to place your right hand behind your neck when you're lying down on the bed. Then use your left hand to examine the right breast. And remember, the areas you need to examine is below this clavicle, all the way to where the abdomen begins, and then from this area below the armpit area, and including the armpit, all the way to this bone in the middle. It's called the sternum. So that's the area you need to examine, all of it. So as you examine in small circular motions with this flat area of your hand, small circular motions, and don't forget the nipple area. As you're examining that, what are you looking for? You're looking for any lump. You're looking for any changes like hardening of one area of the breast, the other one is soft. If there's any issue at all, you need to talk to your doctor, find out whether that is normal or abnormal. So once you examine yourself that way, then you can stand up and also examine yourself the same way on the mirror and see whether there's the same way, the way I am. You just examine yourself when you're standing now and see whether there's any changes. Remember, this is for both males and females. because you're a male, don't say that you won't examine yourself. So it's a very, very simple procedure, and I encourage all of you, do not be afraid to do this. You need to examine yourself. A lump is not cancer, but if in case that you're diagnosed with a cancer, all hope is not lost. You can be able to be treated. If you find it early, the treatment options are quite many. So I did finish some of the questions you asked me, so I'm going to go right into the last few questions. What are the coping mechanisms when dealing with breast cancer? This is Sheila. Coping mechanisms. This is a very good question, because breast cancer is associated with a lot of despair, because when you hear the word cancer, it really hurts your feelings. Some people get depressed, and when you're not feeling well, you're depressed, you're not taking your medication, or you're not going to the hospital, then the progression of that cancer, the progression is usually faster than if you took, changed and still got the medication as you were supposed to get. So how to cope with it? First thing is, if you hear such news, it is okay to cry. It is okay to ask yourself some questions. That process is normal. That process is normal. Trying to get used to the fact that you might have to go to the hospital, you might have to go and get treated, you might need more follow-up. It is fine not to be okay at the beginning, but as you continue, you might need to involve your family, because your family will be able to help you get better. They will be able to support you. If you have a good friend who can do that for you, it is still as well. But remember, you're not alone. You're not alone. And then there's one thing that I always say as Dr. K: pray. God is there. He really does miracles, and he can heal you. There are things that even us doctors, we only know knowledge up to here, but only God is able to help you through everything in your life. So keep God within this, and he will assist you and help you. That's a very good question. There's also the use of counselors, psychologists. Talk to your doctors. They understand you. They are there for you. We are here for you. So don't despair. If you've gotten this news anytime recently, make sure to talk to somebody. So going to the second question, does weight loss help with prevention of cancer? Yes, it does. In fact, increase your physical activity. You actually help your body change and recover, and it heals faster. So make sure you exercise, because yes, if you also lose some weight, you prevent the likelihood of developing any lifestyle disease like diabetes, hypertension, and of course cancers. Question number 3, are mammograms painful? No, they're not painful. Mammograms are not painful, and in fact mammograms are done for women who are above 35 years. If you're 35 and above, you do a mammogram. If you're below 35, you do an ultrasound. So it is very important to even do a routine mammogram, whether you have any issue or not, especially when you're postmenopausal. The next question, how often should I go to the doctor? This is by Lucy. That's a very good question, Lucy. You should go and see your doctor. If you've never seen them, go now. Go now, let them examine you, let them advise you. After that, if everything is fine, it's good to have a yearly checkup, and this yearly checkup it will be specific to your age, whether you're female or male, and if it is about breast cancer and you have family history of breast cancer, there are things that we do to check whether you have the likelihood of developing the cancer. Look, for example, a celebrity like Angelina Jolie. She went and did her tests and discovered that she had a high likelihood of getting breast cancer and ovarian cancer. Make sure to see a gynecologist or a surgeon. They'll be able to examine you, your breast, and all the other areas of your body every year. So this is Dr. K. Make sure to subscribe, like, share, and if you have more questions on breast cancer, make sure to write them down below in the comments, and I'll be able to reply to yours. Doodles!